Hey folks, it's October 27th, it's Friday, and this is our 27th installment of 30 for 30 tips and actions to help you build your medical exercise training practice. And that's our last day for hieroglyphics, or our client MET client management system. So we're going to just talk about a quick summary and the keys here. Now, we've talked about this from the standpoint of this kind of just gives you an overview of all the T's you need to cross, all the I's you need to dot, all the little components you need to do now for the medical exercise training client. And you can see it's a lot different than the personal training client. There's a lot more involved. Probably a quarter of this is what is involved with the personal training client. Now, 100% of this is involved if you really are doing medical exercise training. Now, if you're kind of doing some personal training with a little bit of medical exercise in it, okay. But folks, the need for more specific, more intentional, more goal-oriented, more professional medical exercise training is going to get bigger and bigger because it's the next logical step after physical therapy, chiropractic, and medical care. And the need is going to continue to grow. And the reason it's going to continue to grow is because our medical exercise specialists out there have done a great job showing the importance of that continuum of care with just simply exercise, nothing else. Now, medical exercise training is never designed to take the place of physical therapy, chiropractic, occupational therapy, medical care, nor does it involve any type of treatment, and you're working with clients, not patients. So with that, let me say this. We went through the initial contact, then we went through the initial session where we gathered all of the admin information. Then we went through the assessment process. We talked about the post-assessment, scheduling the sessions, training the client, the actual training sessions. We talked about the progress report yesterday, and today we're going to just simply do a summary, the MET client management summary keys. So, major thing here is, first one, when you get a client and you are now in this initial contact, while they're telling you what's going on, they give you their diagnosis, you need to do a quick thought, just a quick mental check on the anatomy and physiology, the clinical anatomy and physiology of that condition. Vitally important. Everything that's done in any aspect of medicine, whether it's surgery, medications, massage, physical therapy, any type of injections, anything along the way, it's all based on understanding the anatomy and the pathology, physiology, and pathology of the condition. You've got to understand that. If you're not understanding the anatomy and pathology of the client's condition, you're shooting in the dark and you're jeopardizing the safety of your client. Next, you want to always make sure you're looking for red flags. Red flags tell us the client is inappropriate for exercise. The inappropriate client is the one that we want to make sure that we shepherd back for physical therapy, chiropractic, medical services. They also are called the unstable client. They're unstable medically. They need further medical treatment. And with our changes now with insurance reimbursement, you're going to see more and more clients that are going to end up in your practice that they should go back to the physician, therapist, or chiropractor for more treatment. They're not ready for you. Your job is also to identify the deficits and then, based on those deficits, determine which functional outcome measures you're going to use to determine the effectiveness and the efficiency of the exercise program. No longer can we do this personal training where the client just felt better, they had more energy. Now we have to justify our existence by saying their A1C value came down, their BMI came down, their range of motion improved, their strength improved, and we have to now start measuring these things. Measuring functional outcome measures are going to make the difference between medical exercise training becoming just kind of a subset of personal training, or medical exercise training becoming something that medical professionals look at as a viable component of the medical management system. Okay. Also, you're going to develop that MET program, but the MET program, or medical exercise training program, is based on identifying the deficits, the functional outcome measures, understanding the related anatomy and pathology of the client's condition, making sure the client has no red flags, and with that program that you develop, it's all based on the idea the program is going to get the client, the program is going to progress the client to the short-term goals you set for 30 days, and then eventually the long-term goals that you set for 60 to 90 days. So you can see you're literally kind of leapfrogging along the way here, but it all goes back to getting a good assessment. The good assessment starts with a good history on the client, and then you got to document and report everything. Document it, write it down, do your progress report, do your session log. After each session, document what you've done with the client. Personal training client's not a big deal, but the medically based client, that becomes a big deal. You've got to document that. And with this document and reporting, make sure you do your initial assessment. In that initial assessment, you document it. Send out a summary to the client's physician, or if nothing else, just ask the physician or the therapist or the chiropractor if the client is capable of participating in an exercise program. As I said before, one of our MESs, David Jokes, sent out a medical clearance fax to all new clients coming in the door. Even if the client wasn't referred by their physician, this allowed him now to establish a rapport with that doctor, therapist, or chiropractor. It makes a difference. Please do the progress reports. Progress reports, folks, are going to make or break your practice. Now, we look at this as a practice and not a business. A business is I'm always selling something, I'm always doing one-offs, I'm always trying to get new clients in the door. A practice, though, means that you're going to manage this client through the aging process. I'm 56 years old. I'll probably at one point have a hip replacement from 3 pins I had put in the hip as a result of a parachute accident. I've got a damaged meniscus, a torn ACL, and multiple back problems and a little bit of hypertension. For me, I'm the client that you're going to manage for the rest of my life with exercise. Yes, I'll have surgeries, I'll have physical therapy, I'll get medical care, I'll take medications, but exercise should be that constant. I should continually come back and forth to see you for the remainder of my life in what we call the active aging process. That's what active aging is. You're helping me. Aging is going to occur, but you're helping me live better, function better, do more. That becomes the key. And that's why medical exercise training is going to become so important, because the baby boomers, folks, there are millions of us, and we want to do at 56 what we did at 36. The doctors have told us we can't do that, but we come to you because we realize if we exercise, we do better. Next thing, with all of this, all this client management stuff, you are the exercise expert when it comes to managing medical conditions. You're the exercise expert. You're not the physical therapy expert, so don't do treatment. You're not the chiropractic expert, don't do adjustments. You're not the medical expert, don't try to render medical opinions. But please do render your opinions and share your opinions on exercise management. That's the key to long-term management of most medical conditions, and this is where you guys are so, so important. So thanks for listening in over the last, well, I think this is session number, maybe this is our 6th or 7th session that looked at MET client management. This is important. And we actually will go over this more in our MedX Pro 360 program. We're going to go over this even more in our MEPD, or Medical Exercise Program Director Mastermind, that starts on November 12th, I believe it is. And we go into these systems in more detail. Now, we have systems for operations, we have systems for marketing, we have systems for medical relationships. So these systems, you can see, are very detailed, but it walks you step by step through the process. So if you want to build a practice, if you really want to get good at this, start looking at putting these systems in place. So I thank you for listening in over the last several days with this. We've got another 30 for 30 tomorrow because we've still got a few more days left in the month of October. Thank you for listening. All the best in building your medical exercise training practice. And if you would, email me if you have questions at drmike@postrehab.com. Again, check out MedX Pro 360, our community for medical exercise professionals. And we'll see you again tomorrow, folks. Have a great remainder of the week and have a great weekend. Take care. Bye-bye.